like to invite Dr. Noha Karadawi to present her very young cardiologist perspective, which is after all this we hear, I think now everyone is scared to be a cardiologist in Sudan. So without any further ado, Dr. Noha, the platform now yours.
Assalamu alaikum. Can you see my presentation?
Yes, we can see your slide clearly. Yes, and we can hear you.
I'd like to start with saying that I'm very honored to share this platform with the pioneer, Prof. Abdelmonium and my mentor, Prof. SULAFA, and the amazing, I'll call him superhero, Prof. Salah, because of his stories and the hardship that he goes through, and still, mashallah, he looks like he's pulling things. I have nothing to disclose. These are the outlines of my presentations. I think there'll be a lot of repetition because I'm going to be talking about the same as everybody was talking about. I'll start by saying that pediatric cardiology is an essential subspecialty in Sudan, and it did improve and change a lot in the practice of pediatrics. Pediatric cardiology is an evolving subspecialty, so we need to evolve also, and we need to improve ourselves to be to try to follow or catch on the development in the pediatric cardiology. Some facts about Sudan that I got from the net. Population of Sudan as of 2020 is estimated as 40 million, and children make up to half of this number. This is from UNICEF Sudan. Maybe it's an estimate, but it has to do with reality. Some facts that we have very, very busy clinics with very long waiting lists. And as you might know that our elective clinics got suspended because of the COVID-19 as everybody else in the world. So the list of our patients just went longer and longer. We don't have a proper system for patient selection like for the elective clinics. So we see the urgent and the old and the young. Up to my knowledge, there are only 13 pediatric cardiologists in Sudan. 10 of them are acting right now. And we see patients ranging from simple congenital heart disease to very complex lesions to univentricular heart anatomy. And we see them early as in the neonatal period, late or very, very late as adult congenital heart disease. We have also growing population of post-operative patients as well as post-interventional patients. These are growing population, and they are they represent a number of the patients we see in our clinics. Regarding acquired diseases, of course, rheumatic heart disease is a very big burden in our clinics, despite all the effort that run by Prof. SULAFA and her team and all cardiologists in Sudan. Still, rheumatic heart disease is a big burden, and many cases we see. Most of them are from, as Dr. SULAFA said, from Kordofan, but we can see them from all over Sudan. We see a good number of patients with cardiomyopathy. A lot of them are dilated cardiomyopathy, post-viral, and all the other types of cardiomyopathy. We also do screening echo for syndromic patients and for other reasons. Up to my knowledge, there are only 3 pediatric cardiac surgeons to cover the whole of Sudan. They cover both urgent and elective surgeries, and one cardiac surgery might cost up to $3,000 US, and the government pay around half of this price, I think. There is also long waiting list for cardiac patients, pediatric cardiology patients, and while they're waiting, they go through complication or even death. Very small weight patients and complex surgeries get referred abroad, specifically to India, as said by some of the speakers. This is very high cost, and we can prepare our setting here to try to do some of these surgeries here in Sudan. I like this map very much, and I spent some time to put these stars. The red stars are the pediatric cardiologists, and the blue stars are the pediatric cardiac surgeons. So there are 3 blue stars and around 10 red stars to cover all of Sudan. I think the number the map speaks for itself. So more numbers are definitely needed, specifically cardiac surgeons, also pediatric cardiologists. Hospitals with pediatric cardiology services are Ahmed Gassim, a cardiac center, Sudan Heart Center, Medani Heart Center, Salam Center, and Gafer Ibn Auf Hospital, which is a secondary level hospital. I'll touch on Gafer Ibn Auf Hospital because I used to work there. I was one of the staff in Gafer Ibn Auf Hospital for some time. It's, as I said, a secondary level hospital. There is daily inpatient and outpatient pediatric cardiology clinic, and there is a pediatric cardiology ward with 12 beds, and it's the only one, up to my knowledge, in Sudan. So it's the only one, it's the only cardiology ward in the whole of Sudan to cover everybody. There is also an on-call pediatric cardiology fellow with a specialist 24 hours, 7 days a week. Regarding Ahmed Gassim Cardiac Center, it's a tertiary level hospital. There are daily outpatient pediatric cardiology clinics. There is a cath lab, which is not working right now. There is a cardiac CT department, which is a very good thing for us to have it. They have 1 day assigned specifically for pediatric patients. Of course, there is cardiac surgery department. There is pediatric cardiac ICU and HDU. And we started a weekly combined pediatric cardiologist and pediatric cardiac surgeon meeting to discuss cases before they go to surgery. And I think it will benefit us. It will also benefit the patient a lot. And this way, things are going hopefully to improve a lot. There is a pediatric cardiology ward pending. It's now under construction. Hopefully, when the staff is there, it will start. So it will be the second pediatric cardiology ward in the Sudan. What I hope for is for the number of pediatric cardiologists in Sudan to increase, interventional and non-interventional, as Mr. Salah said, that intervention cardiology is very, very important, and it helps a lot and it gives lots of answers. I hope that number of pediatric cardiac surgeons also increases, and for the cardiac centers to be more in every state, hopefully. And of course, we need pediatric cardiology intensivists and anesthetists, as SULAFA said, because intensive care is very important for the patient to survive and do well post-surgery. We need specialized nurse, because nursing is very, very important. And we see that every day in Ahmed Gassim Hospital. The nurse that take care of children are not specialized in children. They're shared with adults. Because the ICU is adult and pediatrics. So we need specialized nurse for post-cardiac surgery, pediatric post-cardiac surgery. We need proper emergency pediatric cardiac services, as Mr. Salah was talking. There is no clear pathway for neonates because of the logistics and lots of problems regarding the ICU and the services. I hope for health insurance for every child, because the cost is too much for people of Sudan to take it. Also, I hope for that health insurance to even be able to cover abroad complex surgeries. And of course, we look forward to better facilities, because not enough is being done. Also, we hope for further pediatric cardiology subspecialties like electrophysiology, CT, fetal echocardiography, and others. There is a register, as Professor SULAFA said, called Super Heart. It's a congenital heart disease register. I think it will help a lot in further improve the service also. Of course, research is publication is the way to go, because we have the material. We have so many patients. We have the material to start research, but we need people to be encouraged, because research will help us a lot in this line. I cannot finish without talking about what I call virtual pediatric cardiology world, because of COVID-19, as you all know, a number of pediatric cardiologists abroad form a network of experts for consultation and for case discussion. We have virtual lectures or lecture series. Also, we have an academic WhatsApp group assigned for the fellows, but we all make use of a very nice discussion and fruitful discussion in the group. Also, there is virtual cardiology conferences, as Prof. SULAFA said, from the Heart Academy, and it's very useful to everybody, and it's a nice way to improve your performance and knowledge regarding pediatric cardiology. That's all for me. Thank you. Thanks.
Thank you very much, Dr. Noha. That was the fantastic presentations. And I think, if you don't mind, can you just unshare your screen, Dr. Noha?
Yeah, sure.
Okay, thank you. I think you've got 2 questions or 3 questions, but I think before that, Dr. Abdallah Jarullah, I think from Saudi Arabia, he sending salam to everyone and thanks everyone, thanks specifically Professor Abdelmonium. So just, and thank you, Dr. Abdallah Jarullah, for your nice comment. I would like just to share with you this, Dr. Noha, and then definitely we'll ask Prof. SULAFA also to comment. So with regard how to improve the training pediatrician who care for neonatal to detect that kind of ASD, VSD, congenital heart disease. I think Dr. Muhti, his question mainly regard how can we improve this kind of neonatal examination, I believe, or how do we have like very strong system for this neonatal to be examined throughout any BDA or congenital heart disease, then we can send them for early intervention. Dr. Noha or Prof. SULAFA, would you like to make any comment on this question?
Okay, I'll try to say something, and then Prof. SULAFA, of course, she can comment. I think in Sudan, because of our low resources, we depend a lot on our clinical sense. I think we are good clinicians. So a clinical examination is very, very important because we don't have the facilities of fancy machines. So yeah, if you did careful, full examination from A to Z, I think you can get to something. If people are having echo machines, they can do the small, easy, like 4-chamber view to diagnose easy things in units. It's not very hard to know. And ideally, I think in every NICU there should be an echo machine, and a neonatologist should be familiar with the basic things. It's not hard, but I think clinical examination is very important. Saturation, upper lower limb, femoral pulsation, murmurs, of course, RVH. I would like to say that you don't have to hear a murmur to know if there is a lesion or not, because large lesions might not cause murmurs, but there is the RVH which is very sensitive and it can show a lot. So clinical examination, which are like full examination from A to Z, is very, very important. An echo machine or X-ray to start with, an X-ray and ECG will also give clues about the patients. And of course, if there is an echo machine, it will be superb, and they can diagnose things.
Okay.
Thank you very much for asking. I think the question is rather early detection of congenital heart disease in general in neonates. Definitely, if you want a very solid diagnosis, you have the fetal echo, not for PDA, of course, for other congenital heart disease, and then immediate neonatal examination. The normal neonatal examination, which is in Sudan, is not optimal at all. The routine neonatal examination can detect a lot of lesions. It is well known that routine neonatal examination can miss many lesions. So nowadays, pulse oximeter screening is well established in many centers. In Sudan, we discussed the issue of pulse oximeter screening. Actually, we wanted to do a small study on pulse oximeter screening, but the main problem in Sudan is early discharge. The routine deliveries are discharged 2 hours only. So there is no way to do the pulse oximeter screening program, except maybe for post-cesarean section, if you want to test the system. So again, we are depending on the symptoms and the referral by the pediatrician. Of course, we are teaching the registrars, trying to improve their knowledge and skills in cardiology in general. I hope I answered your question, Mutia. Maybe
Thank you. I think Dr. Morty, he's still with us here. Now he is able to add any. But Dr. Morty, would you like to add any comment on your question, or shall we just move on to the next question? That's fine. Thank you, Prof. SULAFA. So I think it's suggestion rather than question from Dr. Ahmed. I think it's very good suggestion with regard. She just summarized the main issue. We all agreed, I think, about this with regard training and financial. This is the main issue in Sudan. I think we already spoken about this. She did mention just like about Salam Cardiac Center. Do we have any kind of can we review their policy? Can we get some fellow to train in Salam Center? Can we ask them to do the complex cases? I'm not sure exactly how the situation in Sudan. Do we have any specific policy with Salam Center, Prof. SULAFA?
Yes, Salam Center is a big issue. The previous government, the previous al-Bashir system is they contracted with this center, and they are paying a lot of money, something like $1 million every year or so, a lot of money, while they are not supporting the governmental centers. So it is, from the start, it was a lot of not appropriate, I think, contract. And we went to them, we had meetings with them and with the Ministry of Health many times. Initially, they were not actually collaborating with us. They are not collaborating with us, as if they have some sort of hidden agenda. Then they found that it is not appropriate to do that, and they changed their policy. They became more open with us. They met with us many times, and we insisted on them that we need congenital heart surgery rather than valve surgery, which can be done every day easily in all the centers. And we failed actually to get, they said, the last thing they said to us was they couldn't actually find a congenital heart surgeon. But in general, we have to review with the new, hopefully the new minister, the new system in Sudan, hopefully, we need to review this. It should be put as in the agenda of every cardiology, consultative committee with the minister. The center itself is very good center. It is a nice center built in Soba area, and it is well equipped, but they are not doing any congenital heart surgery or even any catheterization. They just do valve replacement. We are collaborating with them in rheumatic heart disease because it's free treatment. We send to them very poor patients who cannot pay valve replacement, and they are helping in that regard. So we have to review all about the Salam Center.
Thank you. And I think also Dr. Safa Al-Taib, consultant cardiologist, he made a very excellent suggestion also. I will give chance, Dr. Safa, would you like to add any comment, or shall I just go through your suggestion? Okay, so basically, Dr. Safa, she said great to listen to all of you, and she said that it might be a good idea to cross-training, I think like cross-cover between adult cardiologists across Sudan to go for 6 months to cover for pediatric cardiologists, and I think same for pediatric cardiologists also. Would you like to add any comment on this, Prof. SULAFA?
Definitely. We encouraged our adult fellows to join the program. Actually, I'm very happy to announce that the first fellow to join was Dr. Nafisa. She joined us last month, and we started a series of educational lectures in adult congenital. And we told her that she can start with us, and then we will find some communication abroad that she can go and stay for a few months in a center where there is adult congenital heart disease. So already we managed to at least to attract attention for one of the fellow. She is not a fellow, actually, she is a newly graduate specialist. So we are putting, actually, also with the help of Mohammed Hassan, he's with us, is a dear colleague and a young colleague, Mohammed Hassan, and Dr. Ghada Sheikhuddin and others. We managed to put forward a curriculum for adult congenital heart disease that is added recently to the adult curriculum, adult cardiology curriculum. So that is great steps, because we need this specialty very much. We see a lot of very complicated adults in our practice. Today I saw a 36-year-old with PS. We are going to balloon him, but the outcome is really guarded rather than different from a young patient.
Good, thank you, Prof. SULAFA. I think that's exactly what we have now here in I work at the moment in Freeman Hospital, which is a tertiary cardiology center also. We have if you need to train in adult in congenital heart disease, adult congenital heart disease, still you have to go through the pediatric cardiology training for 6 months. And also our colleague, the pediatric cardiologist, intervention cardiologist, Dr. David Crossland, he's the main one. He's doing now this kind of complex intervention for adults. So he got like weekly list, and I've been many times with him. So I think this is a very great suggestion, Dr. Safa. Had anyone would like to add anything or to comment or to ask any question? Thank you very much for everyone sending that nice word on the chat or on the WhatsApp on Facebook. Anyone had any question? Does anyone would like to add anything?
Just one comment. One of the questions or comments was attracting African candidates to the program, to the training program, and that was really an important comment. Actually, we have already one Ethiopian candidate coming to us in the next few months, and we are very interested to receive African colleagues. We are working very close with the Pan-African Society of Cardiology. So in fact, I have to say Sudan, in spite of all the difficulties, if you look at Sudan in comparison with the other, especially the Central African and West African countries, and even East African countries, Sudan is pioneering to a large extent in this specialty, having at least the pediatric cardiology fellowship program. I have to say, even in nearby countries, there are master degrees and PhD degrees in cardiology rather than fellowship programs in pediatric cardiology. And this having the practical and clinical and invasive and non-invasive fellowship program did attract some of the African colleagues and other countries. And this is going to add a lot of experience to our practice and a lot of collaboration. This is an important other thing. I'm sorry for a lengthy talk, but another important aspect is sending graduates like Dr. Noha and her colleagues. After they're finished, we are trying to find a subspecialty training in Malaysia and other countries in CT, MRI, and interventional cardiology. So we are doing that actively, and actually we were promised in many centers that they are going to receive our specialists, and that is highly needed, especially CT, MRI, and intervention.
Hello, Dr. Abdalazeem, can you hear me?
Thank you, Prof. SULAFA. Yes, I can hear you. And I think at this point, I would like to, Prof, would you like to add any comment before we let Dr. I'm sorry, the name on the screen is written Aboudi, so I don't know if that's your name or. But before we'll give you the chance, I think I would like to ask Prof. Abdelmonium, would you like to add any comment?
Yeah.
Yes, go ahead, Prof.
Yes, I was going to jump in when you were discussing the Salam Center. The net didn't help. Anyway, I think we have to have a neutral look at the Salam Center. If you go back to their contract with the government, and that is something to which the Minister of Health agreed, is that they are dedicated to rheumatic heart disease. And they never sort of were asked to do congenital. That's number one. Number two, they truly don't have the staff or the surgeons who can help with congenital heart diseases. Number three is that this is not a national center. It's a regional center. It caters for patients with rheumatic carditis from neighboring countries, such as Cameroon, Chad, Central Africa, and other Western countries. And Emergency, which is the umbrella NGO, which is supporting the thing, is totally committed to support of these countries in rheumatic carditis. They do have new plans now to open centers for congenital heart disease. and they are actually in the process of establishing a hospital in Uganda for congenital heart disease surgery. And I think it's along those lines that we should have approached them rather than trying to impose upon them sort of forcibly to introduce congenital heart surgery in the present setting. I think this is important to have in mind, and they truly may not be able to shift or even add congenital heart surgery, which is a totally different branch, and it needs all the basic infrastructure, which they may not be prepared to go into. I think the negotiation with them should be along the lines of establishing a twin hospital to care for congenital heart disease. Thank you.
Just a small comment.
Can I comment, please?
Yeah, feel free. Sorry, just introduce yourself because I can't see your name on the screen. Sorry.
Yeah, my name is Abdalazeem. I'm a pediatric cardiologist, neonatologist, and cardiac intensivist. I'm working in Brent Sultan Cardiac Center. I'm an intensivist on call now. I'm handling now a switch, which is just done this evening, and tough AV canal. It's very complex surgeries undergoing now. I have a comment to Prof. SULAFA and Prof. Abdelmonium. We all know that this it is a financial issue. It is not a matter of diagnostic problem or training to the people. It's a financial governmental issue. And there is one sentence mentioned in one slide of Dr. SULAFA that she mentioned, Prof. SULAFA, she mentioned that it is a governmental commitment, which is not there. This is the main issue in Sudan. Unfortunately and sadly, the cardiac service in Sudan is progressing too much in advance in pediatric in comparison to pediatrics cardiac service, which is shameful because kids' life should be matter more than adult. Kids' life is more important than adult. And the our main concern and our main attention should be to drag the community and the government, the attention of the community and the government of the importance of this service, of the pediatric cardiac service, pediatric cardiology service, because it is saving life, it is saving kids, which with a small thing like prostaglandin and minor surgery of BDA closure can save life. And the issue of training, the issue of supplement, this will come later. But now to get the attention of the government, new Sudan, and to even the community, that the importance of this service is very important. I have a chat and a long discussion with my friend who's a neonatologist in Canada and now in UK about what is important, because I asked this question before in the question. If I get a $10 million donated from somewhere, and I'm the governor of the Minister of Health, and the Minister of Health, where I will put this money? I will put it in the primary care service, or I put it in a fancy cardiac service. I have a discussion with this guy. He said to me, it's better to go for IV fluid, normal saline drips, and this one to save more lives than to do one fancy cardiac surgery by this $10 million. I said to him, no, it's not calculated like this. Any soul is matter here. In Canada, we are taking, I spent a few years in Canada doing this neonatal cardiac service. We are taking a plane to a very remote area where there is 300 people in a remote area living there, serving by a nurse, community nurse. They call us for a neonate who's 33 weeks, just delivered with respiratory distress. We'll take a plane and we'll bring this baby because life is matter. So the main concern, main effort should be to drag the attention of the people in Sudan, the community, the government, about the importance of this service, the pediatric cardiac service. It's shameful that the adult is doing everything. Every day they are doing hundreds of CAS stent, which is very costly, the stents. And we cannot do BDA ligation. We cannot do coarc repair. We don't have prostaglandin. We don't have, as Salah mentioned, we don't have short-acting beta blockers. It is very shameful to us to work as pediatric cardiac service without any facilities, without any support from anywhere. While the adult is getting all the support, even in the committee in the cardiology service in Sudan, all is handled by the adult cardiologist and cardiac surgeon. I want to hear about this from Prof. SULAFA and Prof. Abdelmonium, please. Thank you.
Thank you very much. That is a very valid comment. I think Mr. Salah would like to add point to your question. Mr. Salah, feel free.
Yeah, thank you very much, Abdalazeem. Thank you, Abdullah. Thank you for your continuous help to us and to Medani. About this comment, if you have $10 million, shall we put it in primary health care or put it in fancy cardiac service? This word fancy is very painful. This word fancy is very painful indeed, because if this concept comes to you and then you have a child born with complex congenital heart disease, you will put your $1 million in treating this child. And this is not the major issue. I depict Professor Sukkar, Mohammed Yusuf Sukkar, talking. We have a confrontation long time ago in Sudan Medical Council. That was a meeting, and meeting involved a big fight, and was very happy about that man. He talked to the people of primary health care that you are taking the money of WHO since the 70s, and still now you have the communicable diseases prevalent, you have malaria prevalent, you have every issue is prevalent. If you concentrate on balancing the health service, if you concentrate in balancing the health service by taking the non-communicable disease management with the communicable disease management, Sudan would have been totally different today. And I depict the experience of the nice Indian friends. I've been visited by an Indian team, Indian surgeon working in Emirates. His name is Jamil Khan, and he used to tell me that you Sudanese are lazy. I used to do congenital heart surgery in my village, in the health center of the village. You know, we bring the heart-lung machine and monitors from nearby hospital, and we stay like few days in our village every few weeks to do a lot of congenital heart surgeries. But you don't do that. So from facilities near zero, Indians are doing congenital heart surgery. I'm not talking about complex and fancy. I'm talking about basic, like VSDs, ASDs, AV canals, partial, complete, in their villages, ya shabab. So don't tell me that fancy service is not a fancy service. Every citizen deserves the best of medical care. If your child or your sister's child has congenital heart disease, you have the money to support her. You are not going to tell her, this is fancy money, I'm not going to give you this money. I will keep it for the real diseases and, you know, things. I think people of you know, advanced medical care should work. People of primary health care should work, and everybody should do his job. Don't tell me that you are a fancy surgeon. I'm not a fancy surgeon. I'm saving a lot of children, a lot of adults. Understand?
Sorry, Salah.
Today's surgery was an adult, but I assisted.
That is what I mentioned exactly. But now I want explanation why the adult is more advanced. Yes. Why the adult is more advanced than pediatrics? Why they are taking all the bread and taking the pediatrics? Let the pediatric to take the fatafit, as we mentioned.
Now you start to talk, and I start to talk, and Professor SULAFA and Abdelmonium start to talk. This will change very soon, believe me. And I'll tell you something else, Abdullah. All the private practice in Sudan is adult cardiology and cardiac surgery, because the money is there, ya shabab. When the money comes to pediatric cardiology and cardiac surgery, this will flip in no time. You will find every candidate in any medical or nursing school want to go to pediatric cardiology, cardiac surgery service, because money is there, you know. Today money is with them. Tomorrow money will be with us on our side. Understand? I don't mean the meaning, you know, that literal meaning. No. I'm telling you that when the concentration and when the graduates increase, when the heart centers increase, when our services increase and start to be nominated, you know, and people start to talk about, oh, first switch in Medani, oh, the first trunkers in Sudan, you know, things will start rolling, Abdullah, don't worry. Even the cardiologist, I started in Sudan Heart Center 2005, and at that time, watching Ahmed and Muhyiddin, Allah yatrahum bil khair, doing valve surgery was like watching Al-Anjil, Al-Malak coming from the sky. You understand? Now I don't do valve replacement, I do valve repairs, aortoids, whatever, or mitral or things. Understand? So your time will come, believe me. Just increase your increase your tarq or hitting, on these issues, increase your graduates, increase your media about that, and things will improve, inshallah ta'ala. Have no worries, ya habibi, have no worries.
Thank you very much, Mr. Salah, and many thanks, Dr. Abdullah. We really appreciate that you're on call now and you're trying your best to share your experience also. Prof. SULAFA or Prof. Abdelmonium, would you like to add any comment?
Just a little comment. I think what Abdullah is talking about is advocacy for the pediatrics. We are advocating strongly, but the numbers are very small. I think we should all feel very responsible. The number of pediatric cardiologists all over the world, the Sudanese pediatric cardiologists, are many. We have a group of 60 pediatric cardiologists. If everybody feels a responsibility towards Sudan and coming back home to help, I think, and helping also from where you are, we should increase the number then. And of course, the number talks. Yani, if you have 50 adult cardiologists and 3-4 pediatric cardiologists, definitely we will, the voice will not be heard. A small correction about Salam Center. Salam in Uganda is not opening a congenital heart center. It is a general pediatric surgery center. And in Sudan, they are willing to establish congenital heart surgery since they have a heart center already. So this is important. We should work with them. I agree with Prof. Abdelmonium. We should work with them to really to recruit pediatric congenital heart surgeons. Thank you very much, and thank you for the group.
Thank you very much, Prof. SULAFA. I think also Dr. Ibtisam, she raising her hand earlier. I guess he moved her from the attendance to panelist. Dr. Ibtisam, would you like to add any comment or to ask any question before we end the webinar?
Hello.
Hi, yes, we can hear you. Sorry, who's that?
Can I come in?
Yes, yes, of course, feel free, Prof. Sorry.
Yeah, just I think we have to retain the Salam Center and try to expand on it. And they are, in fact, very keen to expand their work in Sudan. And it remains on us directing them in which direction the expansion should be. Could be congenital heart disease. And their infamous meeting with the ex-president when they asked for extension of their tenure and extended for more area to expand in, I think that would have been a good opportunity to squeeze in whatever sort of requirements we need to achieve. After all, this is a unique experience of a European setting in the middle of Africa. And there is a lot to learn from them. I think moving to the other subject about the $10 million, I don't think the comparison should arise in the first place. I think we cannot be dragged in sort of treating malnutrition or gastroenteritis and drop development in other areas. All the branches of medicine naturally would be expected to go hand in hand. And I think, as I mentioned, in my talk, the lack of financial commitment by the government to congenital and pediatric cardiology has left us behind by at least 4 or 5 decades. And this shouldn't have happened. During these 5 decades, the whole branch of congenital cardiology surgery has erupted in the whole world, and it has sprung very quickly, and we are still behind. So the more we stay behind, the more difficult will it be for us to catch up. So I think we must look upon the development in medical fields as simultaneous and hand in hand. Thank you.
Thank you very much, Prof. Abdelmonium. And I think Dr. Muhti, he's raising his hand. Dr. Muhti, would you like to ask any question or to add any comment?
Thank you, Dr. Abdalazeem. I am Muti Al-Houri from Saudi Arabia, a pediatric cardiologist. Actually, we cannot conclude or finish this very valuable talk without thanking all the people who are القابضين على الجمر in Sudan. We appreciated every effort they did. Professor Abdelmonium, Professor SULAFA, all our colleagues, Mr. Salah, we know how hard they are delivering this service. We know every detail about the situation in Sudan, how difficult for the families, for the patient, for the physician caring of the people with only just supporting. Many things are deficient. We know, and we feel behind because we should have done more. All people, all cardiologists outside the country, we should have done better than we did, and we call all our colleagues who are attending now to hit, as Mr. Salah said, to hit it while it is hot. We have to raise the issue in our community, in our groups, in our places. We have to find any support, any things that at least sustain what our great professors and colleagues doing in Sudan. We appreciate it. We're thankful for all of them, and we are ready to help by anything. All of us. I am speaking in behalf of all our colleagues outside. We appreciated your work. We know that you are doing it in a very difficult situation. Thank you, and our support with you, if not by hand or even by our hearts. Thank you.
Thank you very much, Dr. Muhti Al-Houri. That was really nice from you, and I just add my voice to you. Definitely, I think everyone need to do what he can do. We need to work together. We need to have a good collaboration. Definitely we need to work together. And I would like just to ask Prof. SULAFA if you would like to add anything to what Dr. Muhti he mentioned. Prof. SULAFA, can you hear us?
Just to say thank you very much, Muti. You're already contributing. Thank you very much. Jazakallah khair.
Many thanks. Dr. Amar Abbas, would you like to add any comment or to ask any question?
Assalamu alaikum.
Alaikum salam.
I'm very glad today to witness this Zoom. شكرا بروف عبد المنعم السيد، شكرا بروف سلافة، شكرا دكتورة Noha التاج, and thank you for the surgeon as well. And especially I'm thanking Prof. SULAFA for her long advocacy role in field of rheumatic heart disease. I used to see Prof. SULAFA in school, in the poor neighbors, different cities, and even في المعسكرات in refugee camps in Yala وغيرها. What I'm saying, what I'm trying to say, even when we used to work in the wilayat, she was trying to contact us and to use us as a young specialist to promote rheumatic heart disease program. Alhamdulillah, WHO now recognize that role, and we have been very proud to hear about that abroad. So now we have Prof. SULAFA recognized internationally. Prof. SULAFA, because of the economy and the state of health in the country, we cannot keep up with the technology and the surgeries and the intervention. But I think we have something that the others don't have. Here in Saudi Arabia, I work with Prof. Abdullah Jarallah, and he was sending his greetings to you and to Prof. Abdelmonium Said. But whenever we have a case of rheumatic heart disease, he used to call me and tell Ammar, you know about rheumatic heart disease more. I think this is our strength. Now there is rheumatic heart disease in Gulf countries and rich countries, but their recognition and their knowledge about rheumatic disease is declining. So we cannot compare ourselves to them in terms of technology, but we know more than them in rheumatic heart disease. How we can use this asset for Sudanese program? Can we, for example, develop fellowship in rheumatic? Can we develop any program in rheumatic heart disease for people in rich countries to come and to learn about this? He is still here, even infective endocarditis, rheumatic heart disease, and prophylaxis, and everything about rheumatic heart disease seems not here and in the international guidelines, it seems deficient. So I'm just suggesting for Prof. SULAFA to have have long role and time in advocacy to Sudan can put forward some program, can pioneer the world in knowledge in aspect of rheumatic heart disease. وشكرا جزيلا، وشكرا لكل القابضين على الجنب، وشكرا للدكتور عبد العظيم. You are adult، لكن ما شاء الله اليوم حركت البيدياتريك كارديولوجي field. شكرا جزيلا.
Thank you very much, Dr. Ammar. That was a very fantastic talk. And yeah, thank you, Dr. SULAFA, and thank you, Prof. Abdelmonium, and many thanks, Mr. Salah. And thank you very much, Dr. Noha. That was really great talk, and I don't think we will be able to say we're finishing now. And I think guests would like to say thank you for your time. It was very appreciated by everyone now taking your time during this difficult time and to come to speak to us and to tell us how the situation in Sudan. We will try our best, and I'm more than happy to collaborate with any colleague. I will definitely get in touch with Dr. Abdullah and with Dr. Ammar Abbas and with all the cardiology fellows and all trainees to kind of organize regular cardiology training, to adult cardiology, to pediatric cardiology. I think definitely we need to work hard, and I think definitely our country needs more and more. And I'm more than happy to give you if anyone had the final word to say before we conclude this webinar. Prof. SULAFA, would you like to say anything?
Jazakallah khair. Thank you very much for this work, great work for us and for the other cardiology specialists. وشكرا لكل اللي شاركوا. شكرا لكم.
Thank you. Prof. Abdelmonium, would you like to add any comment or final word? Salah or Prof.
Thanks a lot, Dr. Abdalazeem, for your concern and for your initiative. And I was very pleased to be in touch with you. Thank you very much.
Thank you, Prof. Dr. Salah, Mr. Salah.
Thank you very much, Sheikh. I appreciate it. Appreciate it. Thank you very much. Very much.
Thank you.
Thank you very much. Thank you.
Thank you very much, Dr. Abdalazeem, for your effort. I wish our country will be improving in everything, and it was nice to brainstorm, and we hope that we can repeat this soon to just follow up on the issue. Thank you very much, Prof. SULAFA, Prof. Abdelmonium, and Mr. Salah. Thank you for the audience. Okay, bye-bye.
Thank you very much, Noha, and thanks everyone who making the time to join this talk. I'm really sorry if we didn't manage to answer all your questions, but we are more than happy to be contact on Facebook or WhatsApp. And there's a few questions here regard, can we have like certificate for attendance? I'm more than happy to get in touch with you. At the moment, I would like just to anoint that we managed to get recognition from Royal College of Physicians. So from today and forward, we more than happy to issue like CBD certificate for anyone attending our courses or our activity. So feel free to get in touch with us, and feel free also to prescribe on the website New Medical Education. And thank you very much, and good night to everyone.